Well, opioid-related deaths are on the rise in the United States. The CDC estimated over 100,000 people died of drug overdoses from October 2020 to October 2021, with nearly two-thirds of those cases involving synthetic opioids such as fentanyl. And joining me now to discuss is Dr. Bob Lahita, director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health and author of Immunity Strong, Boost Your Natural Healing Power and Live to 100. Dr. Lahita, welcome back. So great to see you. A lot to talk about, but first, what do you think is fueling this opioid epidemic now?
Well, the opioid epidemic has been going on for many years, I would say. And we knew that heroin has always been in the streets, and it seems that it's getting across our borders with greater ease. Now, to lace it up and make it even stronger, it's laced with a drug called fentanyl. Now, fentanyl is 50 times more potent than heroin. So they lace the heroin and absolutely cause overdoses in almost everyone who injects themselves with this concoction. The mixture is usually made by some amateur somewhere who doesn't really know the potency of the drug fentanyl.
And it seems like it's definitely more potent than other drugs such as heroin. At least we're hearing that.
Yes, it's very, very potent. And you've heard that in a juvenile detention center in the Midwest, there were actually 4 juveniles and 4 staff members who were overcome because the fentanyl, which can be aerosolized, was in the ventilation system. And we also saw that in Florida at the summer beach party of some cadets from West Point who were overcome with fentanyl-laced heroin. Believe it or not, the rescuers, the people doing CPR and trying to resuscitate these young men, were also overcome with fentanyl and had to be treated with these anti-opiates like Narcan.
It's so very concerning. And also, in addition to drug use, alcohol abuse has also been on the rise. And according to the New York Times, in 2020, alcohol-related deaths actually outnumbered COVID deaths for people younger than 65 years old. Dr. Lahita, what do you think is causing this rise in overall substance abuse, and how can people, deal with stress in a healthier way?
Well, Tracy, it's due to the fact that people were locked down for some time. A lot of people were by themselves and stressed out. And I talk about this in my book, the alienation from other members of society, the lack of companionship, the lack of a compartner, even the lack of a dog or a cat really has a depressive effect on people. So they resort to either drugs or alcohol. And it's so easy to get addicted to things like fentanyl and heroin, and it's easy to drown your sorrows in alcohol. And that's why I was astounded by what you said, and that number is true. Less than the age of 65, alcoholism was increased drinking in 60% of those people increased and actually caused their deaths. So this is extraordinary. And in my book, I talk about boosting the immune system with, relieving stress, taking vitamin C, vitamin D, zinc, doing yoga, doing exercise. All of those things are there to boost your immune system. Even if you've been vaccinated or have been infected with COVID, this is a good thing to do, to get out of the house. And now we're relieving the mask mandates and we're getting rid of all the lockdowns, which is a wonderful thing.
Absolutely. And I was going to ask you that, we're hearing about this new strain of COVID coming along, and we're, lucky to have vaccines in order to prevent infection. But what would be some of your tips maybe to boost our immune system so that we don't get COVID or maybe another type of infection during this time?
Well, the good news is that it is the BA2, which we call the stealth variant of the Omicron, which generally is an upper respiratory infection causing cough, fever, fatigue, and major congestion. This variant is, unfortunately, we don't know the numbers because people get sick, they test themselves, and they stay home. They don't go to the hospital. And we only right now follow people who are in the emergency room, in the hospital, or in the intensive care unit. So what you can do to boost yourself, boost your immune system, is take care of your microbiome, which is the organisms in your bowel. Probiotics, prebiotics, very, very important. Relieve stress, learn how to meditate, learn how to do yoga. These are really critical. I mean, people who undergo divorce, people who get very ill, people who move into a new house, take exams, have an accident in their car, all of these people have lowered host resistance. Their resistance to infection generally goes down, and we know that from both experimental data and practical data. So my advice is get your sleep, get your rest, learn to do meditation, yoga, exercise, and of course, the antioxidants such as that in pomegranate juice and other antioxidants, which are in your supermarket, actually, that should be taken and taken on a daily basis.
Okay, well, great tips. Thank you so much, Dr. Lahita. Always appreciate your time and analysis.
Thank you, Tracy.